Welcome to Geological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. LASA has a special offer for you. Listen for it later in the show. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast. Whitfield Reeves, welcome to our special, in fact, this is the kickoff of our Sports Acupuncture Shop Talk series. I'm so excited to have you. Whitfield Reeves, the godfather of sports acupuncture.
Ooh, that makes me feel old and maybe a little bit cryptic or perhaps even criminal. The godfather, that's rough stuff.
It possibly, but look, you're the guy with the needles that works with athletes. Athletes are tough, man.
They are.
They're a tough group to work with. I mean, like I said, you're the godfather. I say you're the godfather. I mean, you've just been at it a long time.
45 years, maybe?
Yeah, okay, that's a little bit of experience. And athletes are challenging. Excuse me, they're challenging. I know, at least in my work, they're like, okay, can I go out and be up to full speed again, like this afternoon? So they're tricky. There's a lot of things that go into acupuncture, and there's a lot of things that go into sports acupuncture in particular. I'm curious, again, you've been at this a long time. What is it that you're looking for that helps create mastery in your particular specialty of acupuncture?
Well, good question. Mastery is a big word, and mastery is something that you approach, but you never reach. You just keep getting better and you get close. It's a process, in other words. It's never a thing. I'm a master now. You're always approaching this, but in a way, the target keeps getting a little further away.
Oh my God. Is that why I feel like I'm never there?
Yeah, right. Yeah, she's never there. There was a couple of good songs with those words. But at any rate, with athletes, unlike a normal clinical practice, whatever normal is, you have to get good results. You have to be successful very, very quickly. You might not fix the patient, you might not fix the problem, but they have got to see a change quickly. It's just the emotional makeup of the patient. It's a real hot, sharp, shiny liver that's out there trying to cut through things. It's kind of bolstered by an obsessive compulsive spleen doing all these other things. But you've got to be good. That's it. So everything else I say involved in the mastery of this material is under the assumption you have to get good results quickly. It's not a chronic pain patient that you expect to treat once or twice a week for 6 months. Throw that out the window. That's not what we're talking about.
Yeah. So, hey, Mr. Athlete, sign up for my package of 12 treatments. That's just not going to happen.
It ain't going to happen.
They have to see results in the first treatment.
Pretty quickly. Unless you can convince them they can wait to the second or the third. Yeah.
Yeah.
That's not a lot of breathing room.
No, it's not, which, in some ways, look, that's kind of fun because it makes you bring your A game. These people are bringing A games. You've got to bring an A game. So when you say they need to see results, for sure, there are some things they're not going to clear up completely. But like what level of result? And is it that they're getting a physical result completely? Or is it you're doing something to maybe calm that liver a little bit. You don't want to take that edge away. They're an athlete. But is there something else that you're looking for so they can get a sense of, something's going on here?
Yeah, that is a great question. That is the skill of the practitioner. And what I do three things. Maybe this will add up to three. I'm not sure. One of the things that I do is the most important orthopedic test that exists, palpation. We all know how to palpate. Don't be afraid about orthopedic testing. We're skilled at palpating. So I will palpate the problem. And if there is a fixed point, say there's a strain, a muscle strain at the muscle tendon junction, like at bladder 57 in the calf, I will palpate in there, and I will palpate with precision of my angle and my depth and the force of that vector to the patient goes, oh, that's it. That's exactly the problem I have right there. Nobody's ever quite gotten there. And I'll give it an extra little poke, an extra little tug. But in that moment, the patient knows that I know where the problem is. And this is important because there's a...
That builds some trust, doesn't it?
Absolutely, immediately. That'll buy you those 3 days, 3 treatments you need, right away, because they know that you know where it is. And this is a big deal because so much of this is pain referral patterns. So it's not just like, oh, it hurts here and you go there and find it. You actually go back to the rotator cuff for this type of pain, or you go into the gluteus medius for leg pain or something. So it isn't necessarily where the patient is complaining of pain, but it's the primary stagnation. So number one, I do that. Number two, if that stagnation is in a muscle, it's highly likely to affect the muscle in one or two ways. One, it could turn the muscle off, inhibit the muscle. So when we muscle test, say the biceps, we muscle test the biceps and it's weak, they kind of go, oh, yeah, that muscle is weak. Well, guess what? You can needle into that trigger point or that Usher point, take the needle out, retest the muscle, and it's strong. And there's your second moment where you're looking at the patient, they're looking at you, and they go, wow, yeah. They found it with palpation. Now they found it with movement and function. Whoa. And maybe the third aspect is if you have a stagnation, say, in a muscle, we're talking about muscles, we have ligaments and tendons and all this other stuff too. But this is simple. A stagnation of muscle, what may cause stiffness. So when you're trying to fully extend, say, the biceps, and there's a tear in that muscle, it'll hurt sometimes when you extend and stretch the muscle, elongate the muscle. So you see that what happens? You needle the point. Afterwards, you put them back into that motion, and they kind of go, oh, I can fully extend my elbow now and my arm. Wow. So there's 3 things that immediately connect you with the patient with you, and the patient with their own body and what's going on. And you immediately now have some trust, and you have more than one visit to be able to actually make something lasting. And so all that would be under the category of orthopedic testing. Don't get scared by orthopedic testing. You could just call orthopedic testing palpation.
The other thing I love about this, Whit, we could call it orthopedic testing, but it's also relationship building. It's also creating trust. It's also showing the patient, I can find what's going on with you. We can both see changes happening before our very eyes.
Exactly. But you can't relationship build by just saying, hey, listen, I really care for you. I really want to help you. I'm going to do everything I can to help you.
No.
That's not good enough. They need this.
They're results driven.
Yeah, exactly. You could be a real arrogant son of a bitch.
Wait, say that again?
You could be a very arrogant son of a bitch, and they might have full trust in you if they've seen this result, no matter how compassionate your language may be. They need to see that thing. But let me say that I almost always follow that with an illustration. Of course, I have all of my vast number of PowerPoints of anatomical illustrations. And I show them, here's the muscle, and here's right where that problem is. And see how obvious that could be a problem there because there's a bone in the way, or there's a nerve in the way, or it's right where there's a lot of stress. Whatever the issue is, you show them an illustration of what it is. So now they feel it, they experience it, and now they see it and they can think it, which also means they can then go Google it,
which often they do.
Of course they do.
Yeah. Yeah. So you like to speak anatomy
Yes,
to your
sir.
patients, not just speak it, but demonstrate it.
Yes. So, all this has to happen with you speaking anatomy. You can't say there's a chi and blood stagnation and it's got a little bit of wind kind of characteristic and da-da-da-da-da. No, you have got a tear in the biceps, the short head of the biceps, or inflammation in the synovial covering of the bicipital tendon, or what have you. You need to speak anatomy because that's what works. That's what they can then Google. That is what they can then talk to their coach about, and their trainer and their PT. And now you're immediately on the team by speaking anatomy. You're not on the team if you're talking about chi and blood stagnation, wind, and a disturbed shin. You're not on the team. It's interesting. It's cool, but you're not on the team yet. That won't get you there. So speak anatomy.
What about disturbed shin? I'm not saying all athletes have disturbed shin, but look, they're driven and they're focused, and they're not really balanced people as far as I can tell. I mean, really ultra athletes, people at the top of their game, they do not seem to me, again, I don't do a lot of sports acupuncture, but looking from the outside, they are not balanced people. And it's that imbalance in them that makes them so phenomenal at what they do.
You are absolutely correct. Hear me through this short story. It was the last track meet before the 1984 Olympics in Los Angeles. Lots of the Olympians were there, and I was treating one of the American record holder in the men's high jump. And I was doing ear points that I was experimenting on at that stage. This is 1984. It's a while ago, I was licensed to practice in 1981. So I was young. I was fresh, And I used Shin Min because he was a very agitated, very disturbed shin type of person. And he would pace around and this and that. Well, I put in Shin Min before a couple of the jumps. This was still in the practice session before they were doing the first run. He was sitting over on the bench. There's always that long bench. During the Olympics, the bench was filled with a Frenchman and a Slovakian that were smoking cigarettes on the bench, before their jump. But at any rate, our high jumper was sitting on the bench, just chilling. And his coach came over and he yelled at me. He said, "What did you do to him? He never jumps well when he's sitting around calm and refreshed like this. He needs to be doing his cross crawl, all of his massage points and acupressure points. Undo whatever you did because he will not jump well." And I just went, "Whoa, yeah." And I took the ear needle retainer out of the ear. And within about 10 or 15 minutes, he was back to his agitated ways. And the coach went, "Oh, thank God." But it taught me a lot. It's just like, oh, yeah, that we've got to have a whole different criteria for judging personality traits, and emotional, mental behaviors for the athlete if our objective is to help the athlete be an athlete. Now, if we want to help them to be maybe a kinder, better person, that's a different thing. But that's not what they're there for. So,
they are there for one thing.
Yeah.
They want to crush the competition.
Yeah. I had this one athlete. She was a triathlete back in the days of the short triathlon. And she had won like 10, 11, 12 races in a row. She was just killing it, man. She was doing great. She would have flowers. She would bring these little bottles, what she said were genie water and fairy water, and she'd go place them along parts of the run, that would give her energy as she was in the run. And she had all of this stuff that was just so way out there. So I said to her, okay, when you're down there at the starting line and you're ready to start with all this stuff, what are you thinking about? And she said, all I'm thinking about is I want to crush the competition. I want to kill them, and just like what you said, and I just cracked up with all this, the fairy dust and all the entities, these wonderful entities that were going to help her with the race. I want to crush the competition.
That's fantastic. Yeah, I mean, people all have their own way, isn't it?
Yeah, yeah.
Now, oh man, I bet you have just a million stories. I do want to try to keep this focused though, because, we try to keep these shop talks a little bit short.
Yes, sir.
People that would like to do more sports acupuncture, they'd like to get into it, or they like to have a successful practice at it. Beyond some of the things that we've talked about, is there something about mindset that people should have, or just something about how they structure their practices, or how they can go about putting themselves in front of the kinds of people that they'd like to work with? How do you make a sports acupuncture practice?
Well, we've already said you have to speak anatomy and you have to get good results. So that alone could give you a whole bunch to do. You've got a lot of studying to do. You have to speak anatomy, so you have to make sure you have the anatomy, and you have to study it and know it and all that. It's a process of accumulating this information. But most important, yin and yang, if you're going to take in something, then yang, you've got to let go of something. So if you want to do this and you want to accumulate this knowledge, this yin, this, there's not enough room in there. So you got to let go of things. You can't do fertility treatments anymore. You can't do OBGYN. You can't specialize in respiratory conditions or whatever you're doing that may be very interesting, and you might really, truly not want to give it up, And so then you need to say, well, maybe I'm not really designed to be able to do this. But if you really want to do this and do it well, then in fact, you have to give up some of the things that you're doing. You can't have all these chronic patients or these insomniacs that come in once a week to be treated, and you can't do it. There's not enough room. There's not enough time. So you have to give up things in order to get. And I think that's really important. And then the path to that mastery is repetition. So you just have to have repetition over and over, whether it be in teaching, live teaching, or online teaching, or webinars, or whatever you're using. You've just got to repeat and repeat. The thing that's so amazing for me is that my core teaching program, the Acupuncture Sports Medicine Apprenticeship Program, we've been doing this for almost 30 years, and I've never done a part 2. I've never done it advanced. I've never done anything else. This is all that I've done. And people say, well, how do I study with you? Take this program. Well, I already took it. Take it again. And these people take it again, and they kind of go, oh my God, I had no idea the stuff that I didn't get the first time. I had no idea of the precision needed to make this work. And by repetition, then you learn precision. And it's just not taught well in our profession, where 1 or 2 millimeters of depth or angle is so important. And nobody is teaching that. And that's what we try to teach in our work. And I think it's so important, that precision. So I don't know if I'm answering your question.
Oh, you have answered it.
And precision. Yeah.
Repetition, precision. I had somebody recently, because I was having another conversation about mastery, and they said, mastery is a thorough understanding of the fundamentals.
Take my beginning course over and over and over.
Over and over, because mastery is mastery of the fundamentals. That makes so much sense. I really appreciate, too, what you said about if you want to master this, if sports acupuncture is where you want to be, you want to work with athletes, in some ways you kind of have to become like one. You've got to give up the things that take your attention from the focus on what you're doing. And beyond that, it seems when you're working with chronic patients, in some ways you got all the time in the world. I'm going to see you next week. We've got appointments booked out for a month, whatever. But when you're in that mindset of we need to make this happen and we need to make it happen now, that's a whole different place to live out of. It's the acupuncturist's mindset that becomes so important.
Very true. And you have to be able to realize what you just said without it being pressure. As soon as you got pressure and, oh my God, I've got to get good results, man, that's a recipe for disaster. It is just awful. The people that I've wanted to get better, God, if I could only get this. I mean, I remember a patient that came in to see me with this shoulder pain, and he was one of the most famous playwrights in the world, you know. I went, oh my God, I was really young, my second year of practice. I'm going to fix this guy. And I worked and maybe 4 or 5 times. Nothing happened, you know. And then I wanted it so bad to fix this guy, you know. And it was certainly for my own ego and my own reputation. I wanted it, you know. But that's okay. You could want those things. I didn't get it. But he canceled like the 5th or 6th visit. And he said, I'm going to the emergency room. I just hurt so bad. Well, it ends up, right, he had shoulder pain along here. And he had an appendectomy about, you know, an adult ruptured appendix about maybe 2 months ago. So here was the large intestine, everything. He had pain at stomach 36 to stomach 37, Lanwei Shui, along the appendix. So everything was perfect, that this is a large intestine problem. And so I just dug in more and more, did stomach 25, stomach 37, the upper hussy point for the large intestine. You name it, I tried it. Nothing worked. He came back from the emergency room, and what he had was thoracic outlet syndrome when he was in anesthesia and intubation with his head tilted back for the surgery. Scalings had clamped down on the plexus, and the whole thing was being generated from.
You know, I think I heard Whitfield Reeves once say palpation, palpation, palpation.
Yeah. Yeah. And I didn't. I just went, I know this one, man. I know this one. And I was way wrong. So,
telling you, those failures can be so instructive. Time in the boat. That's what it takes.
Yeah.
So, look, for people who would like to learn more about what you're doing, are you still teaching this stuff? How do people find you?
Well, I have a website, whitfieldreeves.com. It's probably one of the oldest old school websites still up on the internet. There's not buttons to push or anything like that. I just written a whole bunch of interesting things and put them on there, you know. I have a calendar page on there where you can see the courses. Right now, my apprenticeship program is being taught by my students. And I say that again. My apprenticeship program is being taught by my colleagues that were my students, and now they are teaching this material. And that happened this year. And so I got a little break. I live in Hawaii, and flying back to Oakland was starting to get to be a little tiring for me, you know. And I turned 75 this year, and I was just like, I need to be careful. I need to take care of myself. So my teaching programs of the apprenticeship program continue under my guidance, but by others teaching. We have a practicum program where people who've taken the original program can come and just practice needling, supervised by some of us. We'll have one in Hawaii this year where I'm supervising. But we have those from time to time. That's helpful. And then I have Net of Knowledge, all of my webinars on Net of Knowledge. And the current webinar that I really love is Mastering the Treatment of Injury and Pain. It's about 40. And I just sat down at the beginning and just started talking. And I just went all the way through from head to toe and all the little things in the middle. And I did a fairly full job of the important things. Now, did I cover everything? No. But anyway, that's a place for you, for one to look that up. And that's with Net of Knowledge. And they have tons of webinars.
They do. They've got a lot. We've got stuff up there too. It's a fantastic, really fantastic resource. Yeah. Well, thank you for joining us today. Thank you for the work you've done. And look, congratulations, because you've created something. You've helped to take acupuncture forward in the world. I love how you talk about you've got students. Wait, actually, they're my colleagues now. And now they're carrying this work forward. So you've created something, a little bit of legacy work there. Much appreciation. Enjoy the extra time off.
Thank you. And I'm very, very proud of what we have created, our community of practitioners that have helped create this. I'm so proud of it.
That's wonderful.
All of what we've done.
All right. Until the next time then.
Your little pieces like this really help too. It just helps speak the word. So I very appreciate what you do. So thank you too.
My pleasure.
Okay.
When you're ready to take your sports medicine practice to the next level, you need tools and supplies you can count on. LASA OMS offers an unmatched selection of acupuncture needles, e-stim, herbal formulas, liniments, topicals, and everything else that you need to treat your active patients with confidence. Visit lasaoms.com to source the herbs and supplies featured in this episode. Use the code SPORT15 for 15% off your next purchase at LASA OMS. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.